ICU nurse. The average salary for an ICU nurse is $90,855 per year. ICU nurse. An intensive care unit, ICU, nurse is a registered nurse who specializes in delivering care to patients in intensive care units of hospitals and healthcare facilities. Their duties include evaluating the patient's conditions, administering treatment, and providing constant support during recovery. ICU nurses or critical care nurses are highly specialized and trained healthcare personnel who provide nursing care to patients with life-threatening illnesses or conditions. They provide specialized experience, knowledge, and skills that patients need to survive or de-escalate care. ICU nurses are trained to make split-second decisions and act quickly when a patient's status changes. Their primary work environment in the hospital is in specialized care units. Typically, ICU patients need a high level of care, and most of them are admitted to the hospital. Role of ICU nurse. ICU nurses work in challenging and complex fields in their nursing profession. They have the primary duty to provide life-saving care to patients fighting for their lives. They are highly trained to provide exceptional care for patients who depend on 24/7 nursing care. A patient in ICU is often ventilated, intubated, and can be on several life-saving machines and medications. ICU nurses are at the top of their game and well-versed with all aspects of specialized care to restore their patients' health and wellness. Some of the specific responsibilities of ICU nurses include: evaluate and monitor a patient's progress and identification of any sudden or subtle changes in the patient's medical condition. Administer medications by routes of intravenous injection, intramuscular injection, gastric tubes, sublingual, transdermal, subcutaneous, and by mouth, PO. Assist in intubation, bedside procedures, and code blues. Deliver regular updates of patients' progress to doctors, patients, and their families. Perform approved diagnostic or therapeutic procedures according to the patient's clinical status. Respond to health emergencies when called upon and alert appropriate doctors. Evaluate patients' laboratory data and vital signs to determine emergency intervention needs. Care for patient needs throughout their recovery journey in ICU. Advocate for patients' and families' needs. Provide emotional support to patients and their families. Set up and monitor medical equipment and devices like medical ventilators, oxygen delivery devices, transducers, and pressure lines. Assess a patient's pain level and sedation requirements. Maintain patient records. ICU department. As the name suggests, critical care nurses primarily work in the ICU departments of healthcare facilities. ICUs are well sanitized and properly lit units with strict adherence to health and safety. ICU nurses typically work on their designated unit but may float to other units, commonly other ICUs. They typically follow a standard shifting schedule that features morning, afternoon, and night timetables. There are also other shifting schedules, depending on the hospital and region. Types of ICU nurses. The following are the different types of critical care nurses. Cardiothoracic or cardiac care ICU nurses. These nurses work with patients suffering from severe heart conditions. They handle a maximum of 2 patients. Medical ICU nurses. Medical ICU RNs mostly care for patients that have a critical disease process not usually involving surgery, such as sepsis, critical cases of cirrhosis of the liver, acute respiratory distress syndrome, diabetic ketoacidosis/hyperosmolar hyperglycemic state, or critical cases of COVID. Neonatal ICU nurses. Neonatal nurses work with newborn babies who face a life-threatening disease or condition. Neuroscience ICU nurses. Neuro ICU RNs mostly care for patients that have had a stroke via a blood clot in the brain or a bleed in the brain. They also care for patients who may be detoxing from various substances, drugs/alcohol, or who have had new or prolonged seizures. They also work with patients with traumatic brain injuries who require ICU-level care, acute/sudden trauma to the central nervous system, motor vehicle accidents, or tree limb falling on head, brain aneurysms, both ruptured and intact, or patients having a sudden onset of changes in their baseline neurological status. Pediatric ICU nurses. These nurses work in pediatric intensive care units and provide care to critically ill or injured children. Surgical/trauma ICU. Surgical/trauma ICU RNs mostly care for patients that are critically ill and unstable as they are in emergent need of surgery. They also care for patients who are post-op from procedures like abdominal or urological procedures, procedures related to motor vehicle accidents, or procedures related to acute traumatic incidents or transplant patients, except for heart. Those patients go to a cardiac ICU. Closely related types of nurses. Flight nurses. These nurses work with critically ill patients who need to be evacuated by air in order to receive specialized treatment. Thanks for watching this video. Any questions, comment below. Thank you all. If you like this video, like, comment and share to all. Thank you.